Heartburn can come in many forms and be triggered by a number of causes. Understanding your particular heartburn symptoms can not only help treat heartburn, it can help prevent it as well. Hi, I'm Dr. Frank McGeorge for Prilosec OTC. Today we're going to talk about the symptoms of heartburn, the second video in this series. Although each individual experiences heartburn in his or her own way, there are some common symptoms that almost everyone can recognize. For most people, it's a burning feeling in the chest just behind the breastbone. This sensation, known as heartburn, is caused by acid refluxing into the esophagus and typically occurs after eating, lasting anywhere from a few minutes to several hours. Now, the pain can worsen when bending over, lifting, or lying down, particularly on your back. Some people experience a burning in the throat, or they have a sensation of a hot, sour, acidic, or salty taste at the back of their throat. Other symptoms that might be associated with heartburn include difficulty swallowing, the feeling of food sticking in the middle of your chest or throat, or a chronic cough, sore throat, or hoarseness. If you're experiencing any of those symptoms, talk to your doctor, as they might be caused by a more serious condition like gastroesophageal reflux disease or GERD, and that needs to be diagnosed. Now, to better understand what may be triggering your heartburn, begin keeping a diary of your symptoms. There are free diary formats available online that can help you record your heartburn symptoms. Use a diary to take notes on the following details. When did the heartburn symptoms start and how long did they last? What did you eat or drink just before the symptoms occurred? What were the symptoms and where did they appear? How severe were the symptoms? How did the symptoms affect you? What, if anything, did you do to alleviate the symptoms? And finally, what, if any, medications did you take to treat your symptoms? Now, if you decide to consult a doctor, your heartburn symptom diary will help them better understand why you experience heartburn and the kinds of treatment that will most likely ease your symptoms. Now, while reporting your symptoms might be enough to make the diagnosis, in some cases, your doctor might decide to perform different tests in order to determine the severity of your condition. I'm Dr. Frank McGeorge for Prilosec OTC.